Hello, everyone. Thank you for joining us for this installment of the Root Cause Coalition's 2017 webinar series. Before we get started, I wanted to run through a few features of our webinar today. All of our attendees will be in listen-only mode for the duration of the webinar. At the end of the webinar, our panelists will be answering audience questions. If you have a question during the webinar, please type your question into the question pane on the webinar control panel located at the right side of your screen. This webinar is being recorded and will be available for download on the Root Cause Coalition website later this week. Thank you all again for attending, and at this time, I'm going to turn it over to our presenters.
Hi, everyone. Thank you so much for joining us today. My name is Sarah Downer. I'm a clinical instructor at the Center for Health Law and Policy Innovation at Harvard Law School, joined by my colleague, Katie Garfield, and we're going to be talking today about how HIPAA affects your healthcare partnership. We're also really thrilled to be joined by our partner from Feeding America, Michelle Berger-Marshall, the Director of Community Health and Nutrition. We have been working with Feeding America for quite some time as they more and more are seeing their food banks and food pantries pursue partnerships and collaborations that are really innovative and wonderful with different healthcare entities such as insurers and hospitals and community health centers and physician offices. So we're very excited to have Michelle join us and talk a little bit about the history of how we got involved in doing this research and work that we've been doing with Feeding America around HIPAA specifically, and how we can meet the goal of enabling healthcare entities to partner more closely and effectively with a lot of different community-based organizations who we'll refer to throughout this webinar as CBOs. Just a caveat before we begin that although Katie and I are attorneys and we are based out of Harvard Law School, this webinar about HIPAA is not legal advice. This is an educational webinar only. It's very high level an introduction to what HIPAA is and the implications that it might have for community-based organizations that want to engage in partnerships with healthcare entities. So, your situation, your unique situation for your organization may be very, very different from what we present here today. So you should always consult an attorney who practices in the state that you're based in. All right, with that, I'm going to turn it over to Michelle. Next slide, please.
Great. Thank you so much, Sarah, and thank you, Monique, for creating the opportunity to talk about this really important topic. You can move to the next slide. As Sarah said, my name is Michelle Marshall. I oversee our health and nutrition work at Feeding America, and wanted to just kick off today's webinar just to give you a little bit of context about how we at Feeding America and our network of food banks came to be concerned about HIPAA, which is something that probably 5 years ago we never thought we would be talking about with our network. But as many folks know on the phone, there's been growing evidence and understanding about the interconnectedness between food insecurity and other social determinants of health and health outcomes like diabetes and hypertension. And we've been really excited to see a swell of energy and excitement across our food bank network in trying to really think about how we can address not only food insecurity but also other health concerns that the people who are struggling with hunger are facing. And as we've grown to understand the interconnectedness, we've seen just a number of activities and partnerships and collaborations start to pop up across the country between our food banks and healthcare entities like hospitals and clinics. We're seeing a lot of screen and intervene opportunities, meaning that healthcare organizations are screening patients for food insecurity and then connecting them with our food banks and programs in the community to make sure that people have access to healthy food. And as we've seen this growing interest, we've also started to hear more and more about concerns that our food banks and their healthcare partners are having when it comes to patient privacy. So our food banks were telling us that their healthcare partners were really willing to screen patients, but that concerns about HIPAA were preventing them from sharing the results of these screenings in a way that would really allow them to have successful follow-up and referrals. And we knew that we needed to figure this out so that we could also not just make sure the referrals were successful, but that we could also find a way to track data that we knew was going to be so important to kind of understand what was working in terms of these collaborations. So our goal here was really to understand what the implications of HIPAA are for these types of partnerships between food banks and their healthcare partners, and to then better understand what kind of capacities needed to be built to be able to handle these patient referrals and the data appropriately so that we could really be in the field and considered good partners to our local healthcare organizations. And so we, without question, in order to accomplish that, we turned to the smartest legal minds that we know, and that's Sarah and Katie, who you heard from just a moment ago, and you'll hear from in just a minute, and the team there at the Center for Health Law and Policy Innovation at Harvard. And they worked with us to create this new report, which is available both on their website and on hungerandhealth.org. And the links, I believe, will be available in the presentation following the webinar. Next slide, please, Monique. So before I turn it over to Sarah and Katie to get into the really exciting discussion about HIPAA regulations, I just wanted to share a couple of examples to give you an idea of how food banks and healthcare partners have worked together to identify patients in a clinical setting who are food insecure and support them with access to healthy foods. So the picture up top, so providing healthy food boxes or meals to patients at clinics or hospitals. This is a really common partnership activity that we're seeing across the country, where this actual picture is from our food bank in Maine, who's working with several outpatient clinics in their community. And when patients are screening positive for food insecurity, they actually go home with a bag of food to take from their doctor's office, and they're provided with this immediate access to groceries. The patients are also referred to the food bank staff who work with the patients afterwards and follow up with local connections to agencies and ongoing access to food and support for SNAP application assistance. We also are seeing a number of food banks engage in bringing mobile produce and mobile distributions to an outpatient clinic, creating actual on-site pantries, which I'm sure many of you are familiar with. And then we know that lots of people are just referring directly to existing local food pantries. And then, of course, and probably most important, is really trying to make sure people are connected to the continuous support through federal nutrition programs like SNAP. The second photo here is from our food bank in New Mexico, which actually has a really unique program in that they're working with a community health center, and the community health workers there are screening their high utilizers in the health system for food insecurity. And then they're referring to the food bank who has created these healthy food centers where patients are enrolled in the program and they can shop weekly for healthy foods to support their diabetes, hypertension, or other conditions that are really driving up their utilization of the healthcare. And all of these opportunities are really exciting and things that we really want to spread across the country. But in order to do that, we really have to make sure that our food banks and our organizations are equipped with really strong knowledge of HIPAA and the considerations they must take into account when they're forming these partnerships with healthcare and trying to share information in order to provide the best services and achieve the best outcomes for the people that we're serving. So without further ado, I will turn it over to Katie and Sarah to talk us through what kind of HIPAA considerations our food banks and other community-based organizations need to be familiar with and learn to navigate as they look to build these exciting partnerships with healthcare.
Fantastic. Thank you so much, Michelle. So we just want to introduce ourselves a little bit before we jump into HIPAA. We're the Center for Health Law and Policy Innovation at Harvard Law School. We are a center of lawyers. We work very, very closely with our law students as well on policy projects across the country. We're a training center for the next generation of health and food lawyers, so we have a practice that specializes in health law and food law. And the lens that we use to view both of those areas of the law are thinking about access to equitable systems of healthcare and food access for folks who are low income or have a lot of challenges or have historically not been able to access these systems or access healthy food for a variety of reasons. Within that vein, we've been working a lot with, especially with populations that have a lot of chronic disease and diet-related disease challenges. And looking at community and clinical partnerships is a special area of focus for us, and the legal challenges that arise within the course of organizations trying to form those partnerships, all for the benefit of patients and the community. HIPAA is something that comes up a lot. Next slide, please. And so we wanted to really dive in and focus on that, especially in the context of our work with Feeding America and the food banks there, that were encountering a lot of questions about how they were going to handle some of the patient data and patient information that might come into their hands in the course of these partnerships and collaborations. So without further ado, what is HIPAA? So we'll start there. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. That's the big piece of legislation that that HIPAA, the term, comes from. But when we are talking about HIPAA in this webinar, we'll talk about not only what the obligations that came to different entities as a result of that piece of legislation, but also of all of the implementing rules and regulations that surround HIPAA. So the privacy rule, the security rule, all of that. So the information in this webinar is synthesized from the legislative text and also the implementing regulations. And HIPAA is enforced by the U.S. Department of Health and Human Services. So they're the organization that makes sure that folks are complying with HIPAA. Next slide. And as Michelle discussed a little bit, there's a reason that HIPAA is so important for community-based organizations or CBOs to be very familiar with. And that is that as they're seeking to partner with healthcare entities in their communities, and many of them have been doing this for many years in informal and then now more formal ways, there's a lot to be gained from these partnerships. And their healthcare partners are thinking about HIPAA all the time. It's something that really, they spend a lot of time and resources on making sure that the way that they operate their practices comply with HIPAA. So it's important for CBOs to understand, what are the things that are driving their healthcare partners or their potential healthcare partners. It's also important for them to understand the basic tenets of HIPAA, to be good self-advocates as they form new partnerships. So HIPAA imposes a lot of responsibilities on the way that organizations handle information, protect information, and store information. And CBOs want to be sure that they're able to handle those responsibilities as they take them on in order to be good partners in order to be good stewards of information for the clients that they serve, good partners for their healthcare partners, and also to make sure that they're not over-promising or exposing themselves to unnecessary liability or risk as a result of the innovative work that they're trying to do. And then finally, community-based organizations are getting involved in handling a lot of the effects of the determinants of health that the healthcare community is more and more aware of as a driver of healthcare costs and health outcomes. So CBOs are increasingly taking on new roles as they form these close partnerships with healthcare entities. They may have folks on staff who can even deliver some healthcare services, and so may want to do that as part of the partnership. And so as they work with healthcare partners and expand some of the services they provide, some of their activities might resemble the provision of healthcare. And HIPAA text is very broad on the definition of what healthcare is, and we'll talk a lot about that in the course of this webinar. But it may be the case that as these CBOs evolve and the roles that they play in delivering some healthcare services in conjunction with their partners evolve, they may themselves become obligated to comply with HIPAA in some ways. And so we'll talk about when that might be the case, but that's something to be aware of as organizations take on new tasks. Next slide. So information that's covered by HIPAA is called Protected Health Information, or PHI for short. PHI is very broad. It can include anything that will individually identify the patient. So you have a list of things here that could be included in that. And HIPAA obligates the entities that are obligated to comply with HIPAA have to take special steps to protect and manage and store PHI. Next slide. And there are two categories of entities that are required to comply with HIPAA. One is covered entities, and the other is business associates. So covered entities, there are three kind of subcategories of those. One is health plans, healthcare clearinghouses is the second, and neither of these community-based organizations don't fall into either of these categories. The third subcategory underneath covered entities is healthcare providers that transmit PHI electronically for certain specified transactions, such as billing insurance, right? So you would think of these as your healthcare providers, your traditional healthcare providers, your physicians and nurses and all of those folks that you would think of as providing healthcare and then billing for services or doing other transactions. But we'll talk about scenarios in which CBOs could fall into this third subcategory in just a moment. And then business associates is the second major category of entities that have to comply with HIPAA. So these are the folks that work with covered entities to do certain things. One is provide certain kinds of services, so you can see them listed out here, legal, actuarial, et cetera, services to a covered entity. CBOs generally don't fall into this category, right, because they're providing other kinds of services to folks in the community. Or the second subcategory here is they conduct activities on behalf of a covered entity. So could this be a CBO? The answer is maybe, and we'll talk about the circumstances under which a CBO might become a business associate of a covered entity and therefore have obligations to comply with some elements of HIPAA. Next slide. But your general community-based organization, so your food bank, your agency that helps with housing, other things that are based in the community, generally doesn't fall into the category of entities that are covered by HIPAA. And so how can you share information with your healthcare partner in a way that is safe for the patient, right, so that doesn't expose the patient data or patient information to unnecessary risk, and also allow you to really collaborate effectively to deliver good services to the patient. So we call this a patient-driven method of sharing information where, the covered entity health provider, so your health insurer, your hospital system, your clinic, your physician, can share certain information about patients with food banks if the patient authorizes such information to be disclosed or discloses it themselves. So a patient would sign an authorization to share certain information. The CBO would receive that, would be able then to get the information from the provider and be able to use that information to deliver really good and tailored services to the patient. So a reach out, a proactive reach out where they call the patient and they say, hey, I see that you saw Dr. So-and-so the other day. I wanted to reach out and let you know that we have these services available on these days and you can come and take advantage of those. Or if you're, for example, for a food bank, you could have you could have the dietary information of the patient provided as well, and then you could say, we have certain food that would be appropriate for someone who has diabetes or some other condition that the patient has, and we invite you to come and to get that specific kind of food so that we can really support your health. So a patient-driven method of sharing information really allows that collaboration to happen between the clinic and the community without requiring CBOs to assume extra responsibilities or liability under HIPAA. So you don't need a business associate agreement. You're not a business associate necessarily if you're doing this kind of information sharing, and it doesn't make a CBO covered by HIPAA if the information is all obtained via patient release. Next slide. So this is the example scenario that I just mentioned, where the patient completes the written request or authorization form for the provider to share PHI with a food bank or a CBO. And then the CBO can use that information to give the patient services. So this might be one objection from the healthcare side was that there's more of an administrative burden for the healthcare partner to do these releases. It's an extra part of a visit or an extra part of a clinical service that they're providing. So, the CBO can also have the patient fill out a patient release of information at the site of the community-based organization. So someone who comes to the food bank could do this at the food bank. The food bank can then give that release to the provider to get the information that they need to better serve the patient. So there are a lot of different ways that this could be structured, but the important part is that the patient is proactively agreeing to release certain information to some of their health information to an entity. And the patient always has the right to do this and can disclose any of his or her own health information at any time. Next slide. So let's go back to the more complicated scenarios of when a CBO might have to comply with HIPAA, because some of the activities that they're doing actually fall into one of these categories that I mentioned of who has to comply with HIPAA. So we're going to look at business associates first. So this is the more common scenario that a CBO would potentially fall into, right? So you might be a business associate of a covered entity because you're providing certain services. Next slide. So as a business associate, you could be a business associate in two ways. Providing specific services to a covered entity, right? So we listed them out. This is generally not CBOs. This is not something CBOs generally need to worry about because they're not doing these things. However, there's this second subcategory of business associates, which is conducting activities on behalf of a covered entity. And that is a very broad term. Includes assisting covered entities with healthcare operations, right? So this is all language that comes from the implementing rules around HIPAA. Healthcare operations include population-based activities to improve patient health. And that is a very broad term. And it's something, the way that you can think about this is generally that if the CBO is doing something that a healthcare entity, so a hospital or a clinic or an insurer, would usually do as a course of their normal business operations, but the CBO is doing it instead, then the CBO is doing it on behalf of, or could be considered to be doing this activity on behalf of the covered entity, and therefore be a business associate. So it's unclear. There are a lot of gray areas because the language in the HIPAA rules is broad. And I don't believe that it was written with this idea that there would be a lot of community-based organizations providing healthcare services to folks. That the language is very broad and it could catch folks up in that sort of umbrella of the definition without I think, fully intending to. But it's important, especially when you're looking at that language, to read the language on its face and be conservative in the way that you approach this. So to say, it looks like if we're, helping a hospital system get better patient outcomes through delivering this kind of, medically tailored food to their patients, and that's a very explicit goal of our partnership that we're working on, we could, in fact, be doing something on behalf of the covered entity. But it's important to note that the being a business associate is a two-step process. So you would have to be conducting those activities on behalf of a covered entity, and also, I misspoke. So you would have to be conducting those activities on behalf of a covered entity. Next slide. So a business associate signs a business associate agreement. So if the CBO falls into that category, you'll be asked to sign by your healthcare partner something called a business associate agreement. We're going to call those BAAs for the rest of the webinar, just for our own sanity. So healthcare partners may be asking you to sign a BAA, even if you're using a patient release of information, because quite frankly, they're used to signing BAAs with all of their external organizations that they work with. It's a practice they engage in because they're being very conservative from a legal perspective. They want to be covered, and they want to make sure that they're, asking their partners to do everything possible to protect patient information, even if the patient has signed a release. So it might just be sort of a business as usual thing for the healthcare partner. But it's important for CBOs to remember that a business associate agreement is a contract. Every time you sign a contract, you're essentially agreeing to incur the responsibilities and liability. You're incurring all of the responsibilities that you sign up for, that you agree to. And so a CBO incurs legal responsibilities and liability for handling PHI, or protected health information, when they sign a business associate agreement. Next slide. So in light of the fact that if you are going to be considering yourself a business associate, if you're going to be taking on tasks that are on behalf of a healthcare provider, or you're going to be signing a business associate agreement, even if you don't think that you need to because your healthcare partner really wants you to, you really have to do a lot of internal soul searching around this decision. Make sure that you understand every aspect of what that business associate agreement is asking you to do. Figure out if your goals could be met using that patient-driven model for sharing PHI, in which case a business associate agreement shouldn't be necessary, and really conducting a realistic internal assessment of whether you can meet the responsibilities and obligations in that contract. And Katie will talk a little bit later about what those are. You always want to consult an attorney. So HIPAA is a federal law. The regulations are federal, and they set a floor for what what can be expected from for an organization in terms of protecting PHI. But states can add to the obligations that these healthcare entities have, or that you have as a business associate. And so you want to make sure that you understand if your state has added additional obligations or has made the language even broader. Texas is one state in particular where we know the language is very broad at the state level about who has to comply with HIPAA. So you want to make sure that you know what your specific obligations are. So you always want to consult an attorney who practices in your state, and you can always look at CBO in particular, looking for pro bono help when cost is a factor is a good way to go about it. Next slide. So then there's a second category of folks who have to comply with HIPAA, and that's covered entities. So these are the folks that we usually think of when we think of, oh, these are healthcare providers, right? These are health insurers, these are hospitals, these are clinics, these are physicians. These are definitely folks that have to comply with HIPAA. So when do CBOs become health providers that are covered by HIPAA is an interesting question, and something that, again, we're asking this question because the language is very broad, and because CBOs are doing all of these new and exciting things in the course of forming these partnerships. Next slide. So focusing on that third subcategory, as a covered entity, the definition of healthcare provider includes providing medical or health services or healthcare and transmitting health information electronically in connection with a covered transaction. So it's a two-part definition of what a healthcare provider is. You have to be providing those services or healthcare and also transmitting health information electronically. So keep in mind that you have to have those two things in order to be considered a covered entity. When we look at the definition of what does medical or health services mean, what does healthcare mean, these definitions are very broad. Next slide. So that's what concerns us when we're thinking about how HIPAA might apply to CBOs, right? So the HIPAA rules include references to these examples of medical or health services. Examples are very broad. They include things like diabetes outpatient self-management training services. And so this is something that I know that there are, for example, many food banks have registered dietitians on staff. Those dietitians do some nutritional counseling for folks when they come in, or they may do things like that. Folks may take blood pressure readings at food banks or in other locations. And so you just want to think about the kinds of services that you're providing. And then, of course, you want to think about whether you're transmitting that health information electronically for a covered transaction. Billing, I think, is the most relevant one. So if you were going to be billing insurance or billing a provider, for example, for a service that you were providing in the community, you could become a covered entity, and then HIPAA would apply to you in its entirety. Next slide. The second part of that subcategory, so providing medical or health services or healthcare. The definition of healthcare, again, is extremely broad here, and you can see it on the slide. It's almost anything that you are doing. But one thing I particularly want to call out is this number 2 here on the slide, which is sale or dispensing of a drug, device, equipment, or other item in accordance with a prescription. And I want to call that out because I think there's a trend towards using that term prescription for a lot of different services. I've heard about prescriptions to walk a trail, prescriptions to go to the Y, prescriptions to get healthy food at the farmer's market. So the term prescription is being used a lot in these kinds of partnerships, and we certainly understand why, right? It elevates the idea that, you know, your physician is really recommending this for you, the patient. You should really do this. It's just, they want you to take it just as seriously as you would take a prescription for a medication. So, but HIPAA also takes that term prescription pretty seriously. So we want to just point out that there is specific language around that term in HIPAA. So if you are, you know, dispensing anything in accordance with a prescription, so if you're a food bank and you're the one who's dispensing the food that someone has a prescription for, you just want to be careful, particularly if you're going to be transmitting some kind of information in connection with a covered transaction, so billing for that service. You want to make sure that you understand HIPAA and understand what you're going to have to do as a result of HIPAA, because it may begin to apply to you. Next slide.
Okay, so this is Katie Garfield. I'm going to be sort of switching gears here for the second half of our webinar. Really, up until this point, we've been focusing on whether or not particular activities of a CBO would make them subject to HIPAA, right, either as a covered entity or as a business associate. However, some of you really may be past that point of just thinking, does this even apply to us? You may actually be planning to really embrace HIPAA by becoming a business associate or even a covered entity. So the second half of this webinar is meant to speak to you, and will therefore focus on what it means to comply with HIPAA. To comply with HIPAA, CBOs must abide by the requirements of the HIPAA rules. Over the next couple of slides, we're going to discuss some strategies regarding how organizations can develop a security management plan to ensure that they've really considered and implemented policies that respond to the HIPAA requirements. However, before we get to that level of detail, this slide just provides an overview on a practical level of the key points that CBOs should keep in mind. So ultimately, as you see on this slide, HIPAA rules require covered entities and business associates to take steps to keep individually identifiable health information secure while still providing patients with access to their own health information. Practically speaking, this means that covered entities and business associates must be prepared to invest time and resources to do a couple of things. First, to assess their risk. So this is really thinking deeply about how protected health information is created, transmitted, or received at your organization, and where the vulnerabilities might exist in those processes, and how you might mitigate some of those vulnerabilities. Secondly, you're going to need to be able to invest time and resources into developing and documenting your policies regarding HIPAA. And this is probably one of the most important pieces here, really making sure that you carefully document your HIPAA-related policies and procedures and the experiences that you have in implementing them. You'll see that as a theme over the next couple of slides. Third, you're going to need to train your staff. It's very important to make sure that your staff is aware of and following your HIPAA policies. As I'll note later on, it's really important to remember that this means all of your staff, so not just your sort of direct employees, this also includes folks like volunteers and contractors. And finally, you're going to need to invest in physical safeguards and technology to protect PHI. Next slide. So now we're going to take a deeper dive into what it means to create a security management plan. The Federal Office of the National Coordinator for Health Information Technology, also known as ONC, recommends that organizations develop a security management plan to really ensure that they've considered and implemented policies to respond to HIPAA requirements. As we go through the basic steps to developing a security management plan, keep in mind that this is just a starting point. Each CBO's management plan is going to be really unique to its needs and capabilities. And again, as we've been mentioning throughout this presentation, it's always important to seek individual legal guidance for your specific organization to make sure that your plan is complete. So the first step of developing a security management plan is to designate your security officer. So this means identifying an individual at your organization who's going to be responsible for developing and documenting your HIPAA-related policies and procedures, and for generally ensuring that your organization is HIPAA compliant. This individual should really be prepared to invest time into really learning the technical ins and outs of HIPAA by reviewing the relevant guidance, government resources, regulations, et cetera. So they're going to be the go-to person at your organization on these issues. Next, you're going to sort of want to preview your security risks, get a sense of what risks might exist at your organization. As we note here, there are some resources available online to help you go through this process, such as ONC's Security Risk Assessment Tool. Then you're going to think through what policies your organization already has in place and how effective they're likely to be. So first, consider where PHI might exist in your organization. Then think through how it's created, received, and transmitted. Again, you're going to want to think about where are there threats or vulnerability in those processes. And those threats could be sort of human threats like cyber attacks, or they could be more environmental things. What happens if there's some natural disaster in your area and there's a loss of data? And finally, again, this is going to be a theme throughout, you want to document, document, document. It's extremely important that you document the entire risk analysis process, including the process itself, your findings, and the actions you took as a result. Next slide. So once you've identified your risks, you're then going to need to develop a plan to address them. This process includes 3 basic steps. First, that security officer is going to bring together a team of people to develop your action plan. Next, the team should decide which strategies your organization should use to address the identified risks. Again, the HIPAA rules recognize that not all organizations have the same exact capacity to mitigate risk, and so there's not necessarily a one-size-fits-all approach to HIPAA compliance. When deciding what strategies make the most sense for your organization, you should consider which strategies will be the most effective and realistic given the size, technical capabilities, and resources of your organization. Again, and you want to make sure that you document your rationale for adopting or rejecting each strategy that you consider. And then finally, you're going to actually develop the action plan. An effective action plan will take identified vulnerabilities, document the appropriate security mitigation strategies and their rationales, and include a plan for implementation. As you can see on this slide, at a baseline, there's 5 categories that your plan should really cover. 1, administrative safeguards, 2, physical safeguards, 3, technical safeguards, 4, organizational standards, and 5, policies and procedures. Next slide. So on this slide, you're going to see a variety of examples of vulnerabilities and mitigation strategies that you could include in an action plan for each of those 5 components I just listed. As you can see, you may also want to use multiple mitigation strategies to address any particular risk. And I should note, I'm just going to give one example here, but the full table is available in the HIPAA resource that we collaborated with Feeding America on, and is available on our website. So, for example, when thinking about physical safeguards, your team might note that your building has insufficient locks or barriers to prevent access to PHI. In that case, an effective mitigation strategy would be to install alarm systems in your building, ensure all offices are locked, and ensure that screens are shielded from secondary viewers. Next slide. So once you've developed your plan, the next step, of course, will be to implement said plan. As with all parts of the planning process, again, it's extremely important for you to document how you've implemented your plan. So as part of your implementation, you're going to need to educate and train your workforce on how to properly protect patient information by following your organization's HIPAA policies and procedures. And as I noted at the outset, this really means your entire workforce, so including employees, volunteers, trainees, contractors, et cetera. And so training should really be a part of any onboarding process. Additionally, keep in mind that training is not a once and done thing. It should really happen repeatedly. So employees should receive training every year or whenever the CBO changes its internal policies. It's particularly important in these trainings to make sure that employees understand how to properly react if there is a security incident or there's an unauthorized disclosure of PHI. And finally, don't forget your organization's business associate agreements. So if you are developing this plan because you have become a business associate, remember that that agreement memorializes a lot of the HIPAA-related responsibilities for your organization. Therefore, it's important to periodically have that agreement updated to make sure that it still accurately reflects your food bank or any other CBO's capacity and procedures. Next slide. And finally, you're going to need to periodically review and update your risk mitigation plan. This essentially means that your organization needs to monitor, audit, and update its security strategies on an ongoing basis. So HIPAA rules require organizations to have audit rules in place, audit controls in place, and have the capability to conduct an audit. Specifically, you should really be able to monitor the adequacy and effectiveness of your security infrastructure and make needed changes. And you should also be able to examine what happens to PHI within the organization. So really what that means is that your system should be set up to document the who, what, where, when, and how of PHI access. So how is PHI being accessed, when, by who, at what location, et cetera. Next slide. So that gave you a brief overview of the various steps that CBOs can take to begin to comply with HIPAA if they've really embraced HIPAA and become a business associate or a covered entity. And now we just want to step back as we're reaching the end of our webinar to really just reiterate what are the key takeaways today. So first key takeaway is that HIPAA regulates the use of protected health information by covered entities and their business associates. In most cases, CBOs are not necessarily covered entities or business associates. Third, CBOs that are not business associates do not need to sign business associate agreements. Instead of signing business associate agreements, covered entities can obtain patient requests or authorizations to share information with CBOs. And finally, if CBOs decide to become covered entities or business associates, they should really be prepared to devote resources to becoming HIPAA compliant. Next slide. And finally, as you could hear from earlier in this presentation, a lot of the law around HIPAA, the law and regulations, are very broad and are not necessarily written with CBOs and these types of partnerships in mind. So we just wanted to end by noting that we are very aware of that uncertainty, and we're hoping to move forward in ways to try and gain further clarity on some of these outstanding questions. And so we're hoping to try and engage with some of the agencies and legislatures that are interested in these issues to see if it's possible to gain further guidance on what HIPAA means for community-based organizations. So if that's something that you would be interested in learning about or being involved in, sort of really trying to pursue clarity for CBOs with respect to HIPAA, feel free to reach out to Sarah and I. We actually have our email on the next slide. So there you go. So if you'd like to reach out to us, please feel free to do so. And so now I think I'm going to turn things back to Monique, who will be leading us for any questions. But if you would come up with a question later on and would like to just reach out to us outside of this webinar, you have our emails here, and we're always happy to respond.
Thank you, guys. I just want to thank all of our panelists today for this great webinar. At this time, if any of our attendees have any questions that they'd like to ask our panelists, I would encourage you to type them into the question pane on the right side of your screen. We don't have any questions right now, but I want to give everybody a minute, if they have some, to type them in. So we'll just wait here a minute to see if anyone has any questions. And just a reminder to our attendees that a recording of this webinar and the slide deck will be available on the Root Cause Coalition website later this week. And that website is www.rootcausecoalition.org. Okay, we have a question from Jennifer. Jennifer asks, do prevention programs like diabetes prevention trigger HIPAA concerns?
So prevention programs, as you saw there, the definition of healthcare can be very broad, and we know that prevention programs are increasingly being, for example, billed for under, for example, Medicare is now going to be billing for diabetes prevention. So it is possible that a prevention program could be considered healthcare, again, because that definition is so broad. I think the important thing to keep in mind is that when you're considering that issue of healthcare, what you're really thinking about is whether or not you become a covered entity and therefore subject to HIPAA. And again, that is a two-step process. So it's one, are you providing health care? In the case of prevention services there, potentially, because that health care definition is so broad. And then two, are you transmitting information electronically with respect to a covered transaction? And as we mentioned earlier, one particularly relevant type of covered transaction is that sort of insurance billing element. So I think it's there is potential there for that to render you a covered entity if you meet both of those requirements. So say you are billing under Medicare and providing diabetes prevention services. Again, though, there is some uncertainty just because of the broad wording of HIPAA, so that's sort of a conservative approach to that question.
Thank you. Rosemary asks, what if a participant shares a medical condition when not asked?
So a patient is always at liberty to disclose any health information that he or she would like to disclose at any time. And if you are not a covered entity or business associate, but you're just a CBO and doing the things that you do in the course of being a community-based organization, and one of your clients happens to share with you their health information, there's nothing special that you have to do with that because you're not regulated under HIPAA. You're not creating protected health information because you're not a HIPAA-regulated entity. So the patient is always free to tell you anything that they want about their own health condition. And indeed, that's one of the ways that an organization can help get information about patients' health to a CBO, is basically giving the patient information about their own health. For example, maybe their dietary needs or some kind of information that the patient then takes and brings to you, the community-based organization, and says, my doctor gave this to me, I need these kinds of services that meet these needs. And that's the patient is the one who's disclosing it. And so that doesn't trigger any HIPAA obligations.
We have another question from Maria, and Maria works at a food pantry. She's a dietitian at a food pantry in Chicago, and she has local nurses from a hospital checking blood pressure, and doctoral students planning a diabetes project. She wanted to know if they don't transmit PHI electronically, and they keep it, I guess, in paper locked away, do they need to do more in regards to HIPAA compliance?
So there's an interesting twist if the folks that are collecting the health information at your site are actually not your volunteers or employees, but are volunteers or employees of your healthcare partner. So the PHI that they are creating is essentially just protected health information that the healthcare entity is responsible for protecting with their HIPAA obligations. However, if they're leaving all of that information at your site, physically in your building, then you're going to want to be careful. And as you say, you're going to want to make sure that it's, kept very, very, very safe. But it is, for all intents and purposes, what would probably be the best case scenario would be for them to come to your food bank to collect the information that they're collecting and to take their files with them at the end of the day back to their home base of the healthcare entity.
Yeah, a thing to keep in mind is that electronic piece, when we were talking about the electronic transmission, that's really for deciding whether or not you're a covered entity. Once you are a covered entity, which that hospital where the nurses are coming from, once you're sort of once a covered entity, always a covered entity at that point. So then, once you are a covered entity, you are responsible for protecting information, regardless of whether or not it's being electronically transmitted. So I just wanted to make that distinction. That electronic transmission is just for the question of whether you become a covered entity. But once you are a covered entity, you would still, those nurses would still be responsible for protecting that information, sort of regardless of how they're recording it.
Thank you, guys. Frederick asks, is it necessary for a CBO to have HIPAA safeguards in place if they're providing preventative healthcare services like chronic disease prevention to the community, but is not in partnership with a covered entity?
So again, this is something that you just want to be careful. You want to think through how are you supporting the activities that you're doing. So if you are, you're thinking about whether you're a covered entity, right? So that chronic disease prevention services could fall under that very broad definition of healthcare. So how are you supporting those services? If it's through grant funding, you're probably okay. If you're, eventually thinking further down the road, well, I'm going to partner with this insurer or this clinic or, so-and-so, and I'm going to, deliver the chronic disease prevention program or services for them, and they're going to pay me for that service, then yes, you would want to put HIPAA safeguards in place. I think it's worth, if you're doing things that, if you're doing things in that vein of, delivering a chronic disease prevention program or some kind of activity like that, it's worth thinking through how you're handling that particular client information and looking at ways to put HIPAA safeguards in place regardless, because you could evolve in that direction. You could see a future in which that would happen to support those activities. But the way that Frederick, I think, is describing it as is, it doesn't look to me like that would be a scenario where they would become a covered entity. But without knowing, what state Frederick is in, that is a particular concern, right? Because the definition of who is covered by HIPAA could be even broader in that state.
Yeah, and that's really important to reiterate here. And again, the importance of chatting to, if you have a very specific scenario that you're uncertain about, to always check with a local lawyer, because again, HIPAA sets a floor, not a ceiling, and depending on which state you're in, you may have even more elevated protections for patients. So just to keep that in mind.
Great. Well, thank you so much to all of our panelists and our attendees. If you have any additional questions for our panelists, you can reach out to them via email. But at this time, I just want to remind you that the slide deck and a recording of the webinar will be available on the Root Cause Coalition website later this week. And at this point, I'm going to conclude our webinar. Thank you all so much.
Thank you.